Hi, myself Dr. Praveen Sahave, Director Abhyuday Pies Laser Hospital, Rameshwari Square and Manish Nagar Road, Nagpur. First, wishing you all a happy chocolate day, and our today's chocolate day subject is related to the chocolate, and that is chocolate cyst. Do you know the chocolate cyst is also known as the endometriosis, and it can affect 5 to 10% of the reproductive age group of women, and it can cause some fertility problems to growing age of the women. A woman with a chocolate cyst may be asymptomatic, or some women may experience some symptoms during the phase of this enlargement of the cyst. So approximately 20 to 40% of the women have endometriosis or the chocolate cyst. This pathology derives its name after the endometrium, that is the mucosa that lines the uterus inside. So we are very conscious about the chocolate cyst. Means, what is chocolate cyst or endometrioma? Chocolate cyst of the ovary or endometria are the non-malignant cysts growing on the ovary, which are either filled with fluid or at the times filled with semi-solid materials. So in this case, it can be referred to as a complex cyst also. So it is called a chocolate cyst because the cavity of the cyst is filled with a dark old menstrual blood and tissue. So it is called as chocolate cyst. So chocolate cyst usually forms when the endometrium tissue gets attached to the ovaries and start growing there. And these endometrial cells may form small cysts first and then stimulated with menstrual hormone, and it eventually multiplies into more cysts. It responds to the hormones and in the absence of the pregnancy. So however, the endometriosis, the blood cannot flow out. It starts accumulating and that irritating the adjacent tissue. Also, this can cause fibrous scars or even form a cyst that are filled with the blood and remnant tissue. So what are the symptoms of the chocolate cyst or the endometrioma? So these cysts are common in the age group of 25 to 40 years due to the intense pain in the lower abdomen, and women experience these symptoms, that is abdominal cramps, painful menses, irregular menses, abnormal spotting or bleeding in between the menses, and pain in the pelvis while urinating or defecating, pain in the pelvis while exercising, painful sexual intercourse, dark colored vaginal discharge. All these are the symptoms which can be associated with the chocolate cyst. And sometimes chocolate cyst ruptures and it can cause severe pain. In pelvic cavity there is accumulation of the fluid inside the chocolate cyst, and these discharge from the chocolate cyst can cause ovaries to adhere to the fallopian tubes also. So this can create fertility blockage and pain to the patient. So causes of the chocolate cyst or the endometrioma is the chocolate cyst can causes or endometrioma is still in debate. According to the researchers, there are several theories behind the cause of the chocolate cyst. One of the reasons it forms is said due to the retrograde menstruation. During menses, the endometrial tissue breaks and needs to extract from our body. And however, in women with the chocolate cyst, the menstrual blood with the endometrial tissue would flow back from the fallopian tubes to the ovaries. This would make the remnant tissue and blood to adhere to one of the ovaries. So it then slowly invades the organ and implants within the ovaries and causing the cyst. Another theory is based on the disorders of the immune system, and which add on the development of the endometriosis, that is chocolate cyst form when the immune system cannot detect endometriosis and starts destroying the endometrial tissue outside the uterus. Another hypothesis suggests that the abdominal cells that are presents since woman's embryonic state retain their ability to become the endometrial cells under the influence of the genetic or the environmental factors. And research has shown that the chocolate cyst or the endometriosis run in the family. There is a family history. If the mother is having the chocolate cyst, the daughter is having chances of the chocolate cyst. So, or the sisters or the family members are most prone for the chocolate cyst. So these are all the causes. Then how to diagnose the chocolate cyst or the endometrioma? A chocolate cyst may be discovered during the routine gynecological examinations either through the vaginal ultrasound or X-ray. A doctor might suggest pelvic UHG examination if you are symptomatic for the endometriosis and if you face some infertility problems. So chocolate cyst is detected on ultrasonographic examination. So the treatment of the chocolate cyst, once the diagnosis is confirmed, the doctor will prescribe a treatment based on the patient's condition and the medication based treatment that helps, like analgesics, painkiller, anti-inflammatory drugs, and some medicines. Hormonal treatments is also required. Chocolate cyst or endometriosis, which are larger in size, are very painful, means more than 4 centimeter, and which may be a reason for the infertility and may turn into the cancerous stage. It is very rare, though it is very rare. Then ovarian cystectomy is suggested to remove the cyst. That is through laparoscopy, endometrial excretions, scar tissues and adhesions that are often origin of the infertility are removed, thus preserving the uterus and the ovaries. During the laparoscopy, there are increased chances of the healthy ovarian tissue can be removed along the growth of the cyst. So removal is also one of the cystectomy with the help of laparoscopic surgery. In severe cases of the endometriosis, if the symptoms keep coming back, cystectomy or adhesiolysis, removal of the adhesions, are not able to cure the disease, then hysterectomy, a part of complete removal of the uterus, is recommended in some cases. So the treatment part depends on the size of the cyst. If the cyst is very small or symptomatic and benign, then routine medications also works. So this is all about the chocolate cyst, and if you want to cure your chocolate cyst, there are some medications in Ayurveda, so you can take benefit of the Ayurvedic medicine. So if at initial stage you can be very beneficial with the capsule dinyl and some medications which is there in Ayurveda. So thank you very much for watching, and once again happy chocolate day to all of you. Thank you.